called it safe. So safe, it was given to pregnant women. And then, across countries, the same nightmare began repeating. In the next few minutes, this story will be reconstructed: how thalidomide spread, what exposed it, and why the US narrowly escaped the worst of it. Because the most terrifying part wasn't only the mistake, it was how normal everything looked until it was too late. It's the late 1950s. Post-war optimism is everywhere. New medicines, new advertising, new promises. Thalidomide is sold as a sedative, promoted as gentle, and in many places, treated like it couldn't possibly do harm. Soon, it's used by pregnant women for nausea and morning sickness. No horror soundtrack. Just a small tablet and reassurance. Then doctors begin to notice something that doesn't make sense. A pattern. Rare, severe birth defects appearing again and again. Families who did nothing wrong, all linked by the same safe solution. Warnings start to surface through clinicians, including Widukind Lenz in Germany and William McBride in Australia, as the link becomes harder to ignore. But a product doesn't disappear overnight, especially when it's already everywhere. By the time the world fully understands what's happening, more than 10,000 babies worldwide have been affected, and many others are lost to miscarriage or die shortly after birth. Thalidomide becomes a global symbol of medical catastrophe, not because science failed once, but because systems failed repeatedly. In late 1961, thalidomide is withdrawn in Germany and soon after in the UK, as evidence and public pressure finally force action. Only then does the public learn how fast a safe claim can outrun the truth. Now the twist. The United States was not hit at the same scale. Thalidomide was reviewed by the FDA, but it was not approved for general sale. One FDA reviewer, Frances Oldham Kelsey, repeatedly demanded more safety evidence, and that insistence slowed everything down. Thalidomide changed medicine forever because it proved a brutal fact. Common use is not the same as safe. After this disaster, the public demanded stronger drug testing, clearer oversight, and real accountability. This is the darkest lesson in modern science history. The danger isn't always a villain in a lab. Sometimes it's a smiling ad, a confident label, and a system that moves too slowly to stop harm. If this story shook you, the next video will cover another case where progress and disaster lived side by side. Subscribe for more dark science stories, short, cinematic, and true.